PowerPoint, please change.
Who's gonna give me the cue?
Ready? We'll start in like 2 minutes. We're just getting the web link up, okay? Can we make sure that the phones are ready to go in the back too? The media phones?
I'm going to say PP.
Yes? Everybody's phone lines
I'm
are,
not going to be able to keep us.
everybody's microphones muted?
Yes.
Up here? Okay. Ah. Are we ready to go for live? Yes. Okay. Oh. 1 minute. Go ahead and go.
Good afternoon, everyone. I'm Michelle Steele, Chairman of the Orange County Board of Supervisors. Today, as you know, Congress passed the CARES Act following passage by the Senate on Wednesday. This package will help boost our economy. It will also help our hospitals and first responders so they have the resources they need to fight coronavirus. I look forward to working with state and federal officials to ensure Orange County families get what they need. We regret to announce 2 additional COVID-19 related deaths. I want to express my deepest condolences to the families those who were lost. Today, we will be providing updates on the county response to COVID-19. We will be communicating information on case numbers, hospital readiness, new data available, testing, personal protective equipment, and donations. With direction of the Board of Supervisors and hard work of our healthcare agency, local case data will be released to the public as of today. Lastly, we are constant need of more personal protective equipment and essential medical supplies. Today we will hear from Dr. Nicole Quick, County Health Officer, David Soleles, Director of Public Health, Frank Kim, CEO of County of Orange. And I really thank you for being here, Dr. Nicole Quick.
Hello, I am Dr. Nicole Quick, County Health Officer. I am very sad today to share the news that 2 more of our neighbors have passed away from COVID-19. We extend our sincere condolences to their family and friends and remind the Orange County community how important it is to stay home and practice social distancing when leaving the household for essential activities or to work in an essential business in order to slow the spread of COVID-19 and help protect our most vulnerable neighbors. I want to mention some specifics on the personal protective equipment. In general, we have distributed the following from our local warehouse and state stockpile. 775,095 masks, 250,000 surgical masks, 5,000 face shields, 45,000 gowns, 5,000 goggles, and 40,000 units of hand sanitizer. There continues to be local, state, and federal shortages of personal protective equipment. Our message to healthcare providers is to continue to submit requests because resources are available but scarce. This will continue to be a priority focus of our planning efforts. All hospitals with emergency departments are operational but have canceled all non-essential services and are actively preparing for patient surge. The system remains at low or below typical levels of activity based on our bed census. Additionally, we are actively working with the state to coordinate a regional alternate care site in Orange County. An alternate care site is used to take care of acutely ill patients outside of a hospital. In closing, community members need to know that we expect more cases and unfortunately more deaths in the coming days and weeks. Please follow the governor's order. Stay home and social distance when leaving for essential activities or to work in an essential business. We need to work together to help slow the spread of COVID-19 and protect those most vulnerable in our community. We understand that residents may be experiencing fear, anxiety, and isolation related to COVID-19. We want to make sure you know that the OC Healthcare Agency is here to support your mental health well-being. Please visit our website at www.ochealthinfo.com/novel coronavirus for mental health resources.
Hello, I'm David Salelis, Director of Public Health Services for the OC Healthcare Agency. I am pleased to share that this afternoon, our dedicated COVID website, www.ochealthinfo.com, novel coronavirus, now features additional case count information that is represented in a variety of ways. The site includes Orange County daily and cumulative COVID-19 case counts in graphed form, charts depicting age and sex distribution of cases, and total number of cases by city. Please be aware our city breakdown chart includes a category called Other, which groups together cities and unincorporated areas in Orange County with a population of less than 25,000 residents. This is done to protect the confidentiality of cases who reside in those cities. It is important to note that city case data is reflective of where the individual who tested positive reside. This does not necessarily reflect where they contracted the virus. City numbers should not be interpreted to reflect where transmission is geographically focused or not. COVID-19 transmission is a risk countywide. Case counts are not reflective of all disease transmission in any given community because testing is presently prioritized for those at greatest risk or most sick. Because transmission occurs throughout the county, it is important for all residents to practice social distancing as directed by the governor and our state and county health officials, regardless of case count in their city. Doing so will help to reduce the spread of infection, ease the burden on our hospital and healthcare system, and protect those most vulnerable in our county. Additionally, please know the OC Healthcare Agency is currently evaluating the best way to compile the number of COVID-19 related hospitalizations and provide that information to the community in a timely way. I know we would all like to be able to report on the number of people who have recovered from COVID-19. However, given the number of cases we currently have and are expecting to see in the coming days and weeks, it is no longer required that someone with COVID-19 be tested and negative in order to be considered recovered, according to CDC guidelines. Therefore, there is no clear and reliable mechanism for us to acquire that data at this time. What we can say, however, is that based on the global experience to date, the World Health Organization estimates that 81% of people who become infected will likely experience mild to moderate illness and recover. And while that is reassuring news, we still must remember there will be more people in our community who will become seriously ill. Especially at risk are those with underlying health conditions and those 65 and older. This is why we cannot say enough times how important it is to follow the governor's and state and county health officials' orders and recommendations. Stay at home and social distance when leaving for essential activities or to work at an essential business. All of us need to be all in all of the time for this to help slow the spread of COVID-19 in our community. Now, a little bit more about personal protective equipment. Multiple hospitals and healthcare organizations continue to report disruptions in their supply chains, with most only getting a reduced amount of their normal orders. Although the HCA has distributed over 1 million pieces of personal protective equipment from our local stockpile since late January, we are seeing low inventory and high need for specific personal protective equipment. There is an overwhelming shortage of masks, gowns, gloves, and eye protection locally and nationwide. We have received hundreds of resource requests for personal protective equipment from all healthcare provider types, and have applied a scarce resource allocation method as we have more requests for supplies than we have inventory. Healthcare providers are still in need of PPE, and we are actively requesting from the state or trying to procure them directly. On Wednesday, March 25th, the HCA began accepting donations of personal protective equipment and supplies for use by healthcare providers throughout the county. At this time, the HCA is accepting donations from corporations and businesses. The following types of protective medical supplies will be accepted in the only new and unopened containers and boxes. All sizes of N95 surgical masks and face shields, all sizes of disposable gloves, eye protection, disposable medical gowns and isolation gowns, and antibacterial and disinfecting wipes. Businesses that would like to donate these critical personal protective equipment should call the Orange County Public Information Hotline at 714-628-7085. Again, that number is 714-628-7085. We are grateful for your generosity and for your support. Thank you for joining us today. We continue to work together to help slow the spread of COVID-19 and mitigate its impacts on our community and our healthcare system. We will now open it up for questions at this time.
Hi, this is Shannon Stabler with the News. Hi, thank you for this report and for the information. Residents of Laguna Beach, including our mayor and all of our city staff, are very concerned with the lack of data. Laguna Beach happens to fall under the threshold of 25,000 residents. On this end, it sounds a little arbitrary that Steel Beach, with a population of 25,073 compared to Laguna Beach with a population of 23,147, would be excluded from this data. Laguna Beach, furthermore, has an aging population, as does Laguna Woods, another city excluded from the data, at higher risk. I know from where I stand, our committee was expecting this data today, including our mayor, and on this end, we're very disappointed not to have this data to communicate with our residents. What was the decision making on this threshold? Again, it does seem arbitrary on this end, and also I would just like to say that from what I can say on my end, that I find it possibly more dangerous to one's privacy and anonymity to not disclose this information. As a news media personnel, I get a lot of reports from a lot of sources, and I would rather that the county release this data than to have neighbors calling, residents calling themselves, that they need to be the ones to self-report in order for their community to get this information. That seems very unfair to the communities and to the COVID-19 patients. And
Is there a question? Is there a question that we can go ahead and ask for you?
The question was, what was the threshold? Why was the threshold 25,000? Why is it that a 25,000 resident city versus a 23,000 resident city is given different data points? What was the determination on that data, and how does it actually help maintain anonymity and privacy of the residents and COVID-19 patients?
Thank you for your question.
So I think what's important to remember here is that we've released the city data today as information to be made available to the public upon request of many individuals who wanted to see the data. The risk to the community is county-wide, and whether your city is listed or is included in the other category, the risk is perceived to be the same, and we ask that all residents from all jurisdictions practice and comply with the orders of the governor and state and local health officials to stay at home when you are stay at home, and if you need to go out for essential services to practice social distancing, or go out for essential work to practice social distancing. The 25,000 is a cutoff that's used in order to be able to assure that we can protect the confidentiality of those who are COVID positive and give them the ability to keep their right to privacy of their medical information.
Next question, please.
Vicki Vargas, NBCLA. Now that you have these numbers to specific cities, Will it help you in any tracking way? I know it's where they reside, not where they were infected, but does it tell you anything more about whether this was family, whether this was beyond that, community acquired, et cetera?
So this is Nicole Quick, County Health Officer. We will continue to follow up with our contact investigation for high-risk individuals, and those would generally be healthcare workforce, first responders, and some other high-risk categories. So this data that was released today does not affect our current contact investigation.
The next question, please.
This is Tony from KSC.
One second, Tony. Can you please go ahead?
Yeah, I was asking about death. You know, we learned that the first death was a man in his 70s. Now with these following two deaths, is there any details that you can release on these two?
We don't have any. This is David Salinas. We don't have any additional details to release at this time.
Next question, please.
This is Jeff Gertson with the Orange County Register. I work on what I call the daily track or the daily basis that we put out in the Orange County Register and goes statewide. My concern is that I've been trying to get from the California Department of Public Health county numbers on cases and deaths. You guys are obviously doing this at a pretty now transparent level by city. But the California Department of Public Health says they do not release county by county numbers for privacy issues. Have you guys, I mean, you guys are definitely giving them these numbers. These are public numbers. Is there any explanation why that would be?
This is David Salinas. I cannot speak for the California Department of Public Health. I think if you have a question related to their data release, you really need to be speaking with them.
Gotcha.
We have a question in the audience, and I'll go ahead and repeat the question, and then for the folks on the phone so they can hear it. Go ahead, Michelle.
David, if I am reading this right, it looks like here in Orange County, the cities with the highest case counts at this point are Irvine with 33.
Can't hear it.
One moment, I'll repeat.
Irvine with 33 and Newport Beach with 32. What do you want to say to the residents and the people who work in those cities?
The question is related to the numbers of cases in Irvine, and what was the other city, Michelle?
Newport Beach.
Newport Beach. What would you have? What would you say to the residents of those cities? Correct?
Yeah, those with the highest counts.
With those highest counts.
I would say the same thing to the residents of those cities that I say to the 3.2 million people who live in Orange County, which is we need everybody all in on the governor's order to stay at home unless you work in an essential business or need to go out for essential needs such as groceries or medical care.
Unknown participant is now exiting.
The numbers by city are interesting and tell us a little bit about the geographic distribution of those who have been tested, but we do know that there are a number of people who have mild to moderate illness who may never be tested. We know that there is risk countywide. We don't want people to assume that because their city either has a high number or a low number that they are either at greater risk or at lesser risk.
Next question on the phone.
What? Hello?
The gentlewoman that is speaking right now.
Oh, hi, this is Chip Yost with KTLA. Kind of on that same note you were just talking about, are there any, in these numbers that you found in the different cities, are there any clusters where some of the numbers were groups of people who either maybe worked at the same business or lived in the same neighborhood?
So this is Dr. Nicole Quick. No, these numbers are not meant to represent any sort of clusters or an outbreak. So to say, once again, this is simply the city of residence of any of the positive cases that we have had reported thus far. And once again, to reiterate, there is risk countywide, and we need all individuals to listen to the recommendations of state and local health officials.
But yeah, I'm sorry, and I understand what you're talking about with the cluster, but I wasn't mean kind of, I guess, the typical term cluster, but did you have, I guess, groups of cases where you had 5, 6 in one, small area in certain cities?
Yeah, so the only data that we can give is the total number of cases per city, which is represented here.
The next question on the phone, Alicia, are you there?
Yes, thank you. Can you hear me?
Yes.
Okay, yes, this is Alicia with the Orange County Register. I guess I wanted to ask, when might you expect to notice a difference in the spread of cases due to the physical distancing and businesses being closed? And as far as continuing stay-at-home orders, do you have a time frame for how long Orange County residents should continue to stay home, or are you going to be taking your cue from Governor Newsom on that?
Sure. So to answer your second part of your question, currently Orange County residents are under an executive order and a state health officer order. So executive order from the governor and state health officer order. As far as when that'll be lifted, that's a question for them to answer. And can you repeat the first part of your question?
Oh, yeah. Well, when might you expect to notice a difference in the spread of cases here in Orange County now that people have begun physical distancing and businesses have been closed?
Sure. So that's a great question. And what we will do, we are about a little over a week into some of the measures that were taken for social distancing. The incubation period for this virus is thought to be up to 14 days. So we will continue to monitor for cases and what our trends look like over the next several weeks.
And this is David Salelas. I'll add one more piece of information that may be helpful for you if you haven't looked at the new data posted on the website. We are doing a daily case count graph, so you will be able to see the number of cases reported daily and represented on a curve to be able to see, are we increasing, are we leveling off, are we decreasing, and that will be updated daily. One more point I'd like to make about all of the data that's posted on the website. It is posted daily because our goal is to try and get as much information out to the community as we can. But please know that the data is preliminary. We are constantly refining and investigating, and you may see some days where a case count drops from the day before, and that may be because we identified the case actually lived in another county and belongs to that county's case count, for example. So just know that all of the data is preliminary. It's updated daily. As we get updated information, we correct the website as well.
Got one question here in the audience.
Okay.
We keep hearing nationally about the curve or the next 14 to 21 days. Can you explain what that means to residents and what you want to share with regard to that information, what you're seeing as you talk to your colleagues in other counties or states?
The question is in relation to the curve and what that means to residents and in other areas.
Sure. So the goal of social distancing is to create opportunities for us to reduce the spread and the time frame by which people become infected. So you often hear the phrase flattening the curve, right? So flattening the curve means we want to spread out over time the number of people who may become infected so that our healthcare system can effectively respond to those who become more seriously ill and may need hospitalization, ventilators, etc. So our goal is to really just flatten that curve, spread that need for critical healthcare services out over time to allow our system to be responsive. You have been hearing, and I think we've talked about the fact that there is significant planning going on statewide for a possible surge. We hope that all of the social distancing measures that are being taken statewide, with our entire state being all in on social distancing and staying at home, will help to flatten that curve to some extent in the coming days and weeks.
If I can go to a question on the phone.
Hey, this is Marie Sforza from the Orange County Register. Can I get in here?
Sure can.
Hi, yeah, no, I was hoping that Dr. Clicker or someone could talk a little bit more about the warning that was issued about the serology test that's being done by the doctor in Little Saigon, and I guess the differences between the PCR test and the serology test and what the dangers there might be.
Sure. So just a basic sort of overview of the types of tests we have available for, in general, viral infections. The PCR test that is done can detect a small amount of the virus particle in a specimen from an individual. So for COVID, that's a swab that's done in the nasal cavity. It's run through a machine that can detect a small amount of the virus. The other type of testing parameter that we sometimes will use for viral infections is what's called serology. So you take a blood sample and what you're checking for is antibodies. And that would be antibodies that your body has developed for a virus. The point we were making with the press release and that I would like individuals to understand today is the FDA has yet to review or issue an emergency use authorization for any of the serology tests. And what that means for us is we do not have parameters right now to interpret those results. So an individual who has taken a serology test may either have a false negative or a false positive, which may affect their medical treatment in a negative way. Going forward, we hope that there will be expanding test capacity across all of the U.S., California, and Orange County, but we want individuals to use the tests that are safe to use and that we know are validated.
Is there anything that the county or any other officials could do to I don't know, I guess stop this sort of testing, or that's just up to folks?
So as far, I'm not going to speak to any individual providers out there. What we would like residents to do, if there's a question, is call our health referral line or the county hotline if there's a specific question about testing.
We have a question in the audience, and I'll go ahead and repeat the question for those that are on the call.
Yeah, Paul Anderson with City News. I wanted to ask about the jail situation. Whether there's been a recommendation from the union to shut down the barracks or dormitory style housing in the jails, and what your thoughts are on that, whether that should be done, and make more of a, also the sheriff is doing early release, and I wanted to get your opinions on those policies going forward.
There's a question about the jails and if there's possibility of actually closing some of the barracks in relation to it, and if there's any union issues with that. We don't have a representative from the sheriff's office here at this time, but if you, Dr. Quick, if you want to talk about just the case, if you know anything, information.
I'm not going to speak to specific union matters that I'm not aware of, and I do feel like your question's probably appropriately asked of the sheriff. I can speak to the fact that the healthcare agency, Jail Correctional Health, and Sheriff Department has taken significant steps to put into place plans for communicable disease control, including COVID-19 disease control in the jail.
But I mean, is that this? I'm not talking about union issues. I think you misunderstood my question. My question was, as the health officer, do you think that it's a good idea to not house them in dormitories anymore?
The question is about housing the inmates in dormitory settings if the public health director, Dr. Nicole Quick, thinks that's prudent.
And once again, as far as specific communication about that case and where that individual is housed, I still feel that's a question that's more appropriate for the sheriff.
Next question on the phone.
It's Vicki Vargas again from Channel 4. I believe LA County has now taken another step towards closing down public areas like beaches and piers. I know our parking lots are closed at those facilities in the county. Is this going to be a one step at a time, or are you moving that direction, and is that something we see before the weekend?
Hello, this is Frank here. I'm the County Executive Officer. We've had that discussion today with our Orange County Parks Department. So we are evaluating the residents and how they're following the orders that were issued by the governor as well as our local health official. And we will make that determination in the coming days, but we would like to evaluate that over the next few days.
We've got time for two more questions, one from the audience and then one from the phone. I'll take the audience. Michelle?
UCI Medical Center, as you know, is the only hospital in Southern California conducting a clinical trial on remdesivir. Can you please give us an update as to how that's going, what information you have, and how you feel about that antiviral drug as a possible treatment for COVID-19?
The question is about at UCI doing a type of medication called, how do you pronounce it?
Remdesivir.
Remdesivir, and whether or not it's been seen as helpful.
So appreciate the question. There are a number of different trials going on around drugs as well as vaccine efforts. We can't speak to any specific trials of UCI in particular, but what I will say is we know there is national and international focus on both identifying possible treatments that can help to mitigate the severity of illness in those who become ill, as well as a very strong desire, I think, amongst all countries to identify a vaccine that may be available. Those are all a ways out before we see them in terms of being something to help us slow the spread. So where that leaves us today is back to our core message, which is stay at home unless you need to go out for essential services, such as grocery shopping or healthcare. Stay at home unless you are an essential worker in an essential business, and social distance whenever you're in public. Those are the best tools available to us today to help slow the spread of this disease.
Molly, wait, just one quick follow-up.
I have a question, last question from Tony, ABC7. It's going to be a nice weekend. The weather's going to be gorgeous. Is there any final messages to people, as comparison to last weekend when we saw a ton of people out at the beaches, out at the parks? Will there be extra enforcement this weekend?
This is Frank Kim, the County Executive Officer. Over this last few days, since the county took the appropriate step of closing the parking lots in our beaches, we have gone out to all of our facilities, added additional signage with clear guidance to the residents who are enjoying those amenities, and we will be out over the weekend evaluating how the residents are complying with those orders. So again, this amenity within Orange County are wonderful beaches and parks. These are wonderful opportunities for us to enjoy the outdoors, get out of our homes, and safely practice social distancing. But again, if those orders are not followed, unfortunately, it's likely then that we would have to take this next step. We are hoping not to. So we encourage all residents to enjoy those open spaces, but do those responsibly. And we thank everyone for that.
Thanks.
Again, we'd like to thank everyone that joined us on the call today, and that will conclude today's press conference. Thank you so much.